Let's take a look at our case study on congestive heart failure. Now, congestive heart failure is very, very common these days. As you probably heard, heart disease, #1 killer in the U.S. I think everybody knows why that is. It's all about lifestyle and how people are living for the most part. But let's look at our case study right here and talk more about this. So part one, we've got Mark here, 70-year-old male, has lived most of his life with relatively few health problems. So in his life, he worked as a teacher, didn't get too much exercise as he would have liked. Like a lot of people, hadn't made the best choices when it comes to diet. All sounds familiar, doesn't it? In his past, he did smoke cigars on a regular basis for 20 years. Now he has one occasionally. So recently, Mark has decided to exercise more often. Has been jogging 3 or 4 times a week. You often see senior citizens out moving around, staying active. It's always the best thing to do. This decision was made after Mark's doctor found he has high blood pressure. As part of Mark's usual routine, he starts his Saturday afternoon with a jog around his neighborhood. After about 2 miles, Mark starts to feel chest pains and finds he's experiencing shortness of breath. He decides to finish his jog regardless of the pain since he's almost home. He reaches his neighbor's yard and he collapses. Soon after Mark collapses, his neighbor sees him and rushes out to assist. So he finds Mark unresponsive and an ambulance is called to rush him to the hospital. So after arrival at the hospital, they find the following: elevated creatine phosphokinase levels, 85% blockage of the left marginal artery and 75% of the left anterior descending, blood pressure 160/110, unusual lung sounds, and shortness of breath. So now we got some questions to go along with this. Well, we mentioned up here this CPK, right? Creatine phosphokinase. What is this CPK and why is it elevated in Mark's blood? Now, what this CPK is an enzyme, and it's found in a few cells of the body. Cardiac muscle cells are just one of them right there. It's involved with energy production. Now, here's why the amount of this in his blood is significant. Ordinarily, there should only be trace amounts of this CPK seen in anybody's blood. But what this can be used as is an indicator of a heart attack. If you're saying that somebody had a heart attack, a myocardial infarction, you're literally saying heart muscle cells died. Remember, when cells die, they lyse. In other words, they rupture and all their contents spill out. So the point being, this CPK should not be in his blood. It should be inside those cardiac muscle cells. But if you suddenly see a lot of this in the blood and you think somebody had a heart attack, it's a good key indicator that they did, because it shouldn't be seen in the blood. It should be inside those muscle cells doing its job. So there's lots of things you can look at as an indicator of a heart attack. That's one of them right there. What is the significance of the blockage in Mark's left marginal artery and left anterior descending artery? That left ventricle of the heart is your biggest, strongest pump by far. It's what pushes blood from the top of your head to the tip of your toes. So look at what he's got, a very large amount of blockage in the arteries going to that pump. So they think this guy had a heart attack? Well, look what we've got. We see a huge amount of blockage going to the left ventricle, which is where most heart attacks occur. We see this CPK floating around in the blood, which should be inside cardiac cells, but when they died, it spilled out. Those are key indicators of a heart attack. So those are big blood supplies going to that left ventricle. Really don't want to see that there. Number 3, would Mark's high blood pressure have anything to do with his heart problems? Now think about this. What's wrong with having high blood pressure? Why do we check it? Why do we care? Remember that blood only moves around the body from an area of high to low pressure. So as we allow the pressure in our arteries to get higher and higher, it has to be higher at the heart. Because if it wasn't higher at the heart and lower everywhere else, blood wouldn't move away from your heart. Blood flow would stop, you'd be dead. So you don't want high blood pressure because it forces your heart to work harder. And the harder your heart works, the quicker it uses up ATP and oxygen. And if cardiac cells ever run out of ATP and oxygen, that's when a heart attack starts right there. And cardiac muscle cells can only go 20 minutes under anaerobic respiration. If they run out of oxygen, that oxygen supply had better be restored in 20 minutes, or those cells are dead and they're not coming back. What is causing the unusual lung sounds? Well, think about what happens when the left pump fails, right? Looking like here, this guy probably had a heart attack in the left pump, meaning he lost some of the muscle in that pump. We have to remember that your heart's two separate pumps. There's one on the right, one on the left. You can damage one and the one on the other side will just keep right on working. At least for some time it will. So look at this. He lost some of the muscle in his left pump. The right pump is still strong, which is pushing blood into his lungs, and blood is largely water. The weak pump on the left now can't pump it out. So you've got a strong pump into the lungs and a weak one trying to pump it out. Fluid builds up in the lungs, and unusual lung sounds are usually caused by fluid buildup there. So now we got part 2. After further testing, the doctors find the following. Mark is still short of breath and has greater trouble when he's lying down. He has a blood pH of 7.32. That's acidosis. That means that pH number's gotten below that 7.35. Mark always feels tired and weak. I guess he does. He's not pumping as much blood and oxygen as he used to. An X-ray reveals that his heart is enlarged and the lungs are hazy. An ECG, that right there, reveals a prolonged QT interval. We're going to look at the ECG a little bit further along. An echocardiogram reveals that the ejection fraction of the left ventricle is only 25%. That's far less than what it should be. The echocardiogram reveals the left ventricle has an increased diameter and the wall has thickened. So now we've got a new set of information. Why is Mark short of breath, and what is this condition called? Well, Mark is short of breath because that strong right pump is still pushing blood into the lungs the way it used to. The weak left one can't pump it out. Fluid builds up in the lungs. When fluid builds up in the lungs, you won't get adequate gas exchange. So he can't get in oxygen the way he used to. You bet he's going to feel short of breath and at the same time tired and weak. Do not want that fluid buildup in the lungs, never going to be good. Why is Mark's blood pH out of balance, and what is this condition called? Oh, and something else up here on the short of breath, dyspnea. D-Y-S-P-N-E-A, dyspnea, I believe is how you spell it, is when somebody's short of breath. A lot of things can cause that. But number 2, why is Mark's blood pH out of balance, and what is this condition called? Why is this pH out of balance? Well, remember, he's got fluid buildup in the lungs. Remember, you breathe, you move air in and out of your lungs for basically 2 reasons. To get oxygen into the blood and carbon dioxide out. So due to that fluid buildup, he can't remove carbon dioxide the way he used to. We've looked at this chemical reaction before. Whatever happens on one side of the arrows happens on the other. So due to the fluid buildup in the lungs, he can't get rid of CO2. As CO2 builds up in his blood, so does hydrogen. And when hydrogen builds up, that's called acidosis. That's when the pH number is too low. The blood is too acidic at that time. Why is Mark always tired and weak? With inadequate gas exchange, he won't get enough oxygen in. Remember, oxygen's needed for aerobic respiration. That's how you make almost all ATP. So not enough oxygen, not enough ATP, you bet he's going to be tired and weak. Why is Mark's heart enlarged? Now think about this. He initially lost some of the muscle in that left pump. So some of that cardiac muscle in that left ventricle was lost. But now later we see his heart enlarged. Well, think about this. If some of those cells in that left ventricle were lost, the remaining cells have now got to work harder than they did before because they're trying to do the job they were always doing plus the job of the muscle cells that were lost. And if you work muscle cells harder and harder, they grow, they get bigger. And the high blood pressure is adding to this. The higher your blood pressure gets, the harder the heart has to work. You're going to see an enlargement of that heart because like any other muscle, you work it harder, it's going to get bigger and stronger. Number 5, why do Mark's lungs look hazy? Fluid buildup in the lungs is what usually causes that right there. Number 6, why is the QT interval on the ECG prolonged? A prolonged QT interval represents reduced left ventricular systolic function. That left ventricle is not contracting. It's not generating pressure and pushing blood the way it should. What should the ejection fraction of the left ventricle be? We see that his is at 25. It should be at 60. So he's got a big problem. He evidently lost a lot of muscle in that left ventricle. So over the next few weeks, Mark's condition doesn't improve. I guess it doesn't. Remember, as a general rule, once you've lost muscle cells or neurons, they don't come back. So that heart's never going to work the way it did before. What lifestyle changes might Mark's doctor recommend to him? First of all, no smoking. Smoking does a lot of things, but inhibiting oxygen delivery is one of them. Again, a lack of oxygen and ATP is what caused a heart attack to start with. A diet low in fats. We saw he had huge amounts of blockage in the arteries going to his left ventricle. That was a big thing that added to his heart attack. He needs to quit clogging up his arteries with plaque, which is just fat. Control the high blood pressure. That'll ease the workload on the heart, and hopefully he won't have another heart attack. You got to remember that most heart problems are caused by lifestyle. So unless you reverse that lifestyle and get back to something away from that, something that's not harmful, you're probably not going to do any good at all. Number 2, what medicines might Mark's doctor prescribe? Diuretics is one. Diuretics cause you to lose water. Remember that blood is largely water. So when you go to losing water, that's like losing blood. Blood pressure will drop. That'll ease the workload on the heart. Hopefully that'll keep him from having another heart attack. Digitalis slows and strengthens the heart contractions, and that's what makes a really good heart, a slow and very strong one. Because you figure if it's contracting slowly, fewer beats per minute, it's not using up a lot of ATP and oxygen. And with a strong, forceful contraction, it'll push more blood. So you're pushing more blood and oxygen and using up less oxygen all at the same time. Vasodilators will drop blood pressure. That'll ease the workload on the heart. Calcium channel blockers will dilate vessels, and so on down the line. All those are very good treatments. What other treatments might Mark's doctor recommend are available to him? This gets worse. They might have to get in there and see if they can remove some of the blockage from those arteries going to his left ventricle. He might even need heart transplant surgery. If he lost a very large amount of muscle in the cardiac cell and all those cardiac cells itself, he just may. Question set 4. Why is Mark continuing to suffer from left side congestive heart failure? How does this differ from a heart attack? All right, now let's first look at heart failure versus heart attack. Heart failure basically means your heart can no longer do its job, right? It's lost its pumping efficiency. Something has happened. So if somebody has heart failure, you need to ask yourself, well, what's causing the heart to fail? In this case right here, a heart attack. Now remember, heart attack, myocardial infarction, means heart cells died, right? An infarct is an area of cell death. So he has heart failure because of the heart attack. And the type of heart failure he has is left side. Remember, he lost muscle cells in the left pump. So he's got left side congestive heart failure. And again, think about what happens there. Right pump is still strong. We have no reason to believe that he damaged the right one. It's pushing a lot of blood into his lungs, which is largely water. The left pump that's weak can't pump it out quick enough. The fluid builds up in his lungs, and you can't get adequate gas exchange. What is the difference between left and right side congestive heart failure? Again, with left side, there's where the left pump fails. The strong right pump pushes a large amount of blood into the lungs. Weak left one can't get it out. Fluid buildup happens in the lungs. Inadequate gas exchange as a result of that. But let's say somebody had a heart attack and lost muscle in the right pump instead of the left one. Well, you figure now the right pump is weak. So you've got a left pump that's strong, pushing blood out to the body, and a right one that's weak, trying to pump it out. Now fluid's going to build up all over the body, pretty much everywhere except the lungs, and you'll really see it down in the feet. The feet be swelling as they'll have fluid out in that area. It's where vertical and gravity pulls the fluid down. Swelling in the feet is often where you see it first. And again, we could also say that when the left pump fails, you also don't pump enough blood out to the body. And when the right pump fails, you don't pump enough blood to the lungs, because that's what those two pumps do. Got to remember, your heart is not a pump. It is two different pumps, right one and left one. So there's all the answers once again right over there. But heart failure, very big and largely due to heart attacks. Very, very common. You're going to work with healthcare, especially the elderly. Going to see a lot of this right here. So don't forget this material here on congestive heart failure. Very good stuff to know.